Okay, well, good morning, everybody. Really good to see you, and welcome to the first in our series of HR how-tos, which is a sessions that we've put together to try and help you deal with some of the issues that are foremost in your businesses or in your teams, or that you might be struggling with as a manager. So the idea of these is they're short. I'm going to walk you through some of the more practical things to think about for the topic, and then give everyone a chance at the end to ask questions. I would obviously just say that you might want to make sure that you keep any employee information confidential, because that obviously is not what we should share. But we would welcome questions. Feel free to put questions in the chat as we go also, and we can we can answer them from there. So today I'm going to talk to you about employers' responsibilities for mental health and well-being, looking at early warning signs around employee mental health, how to respond to concerns, what legal actions employees can take, and ways to deal with mental health in the workplace. All of this is a combination of the work that we do with all of our clients every day and each week, and also our experience in this area. So first and foremost, I'd be interested to hear how you think at the moment, what you think at the moment is impacting your employees' mental health and well-being. So is it current inflation or cost of living? Is it more pressure and less resources? Is it their own current personal mental health and well-being challenges, worrying about their roles, or an increasing workload? So I would ask you just to take to the chat and drop in there what it is that you think is the reason for your team maybe experiencing mental health issues. Just give you a couple of seconds to do that. B and C, Jody, yeah, absolutely. B, yeah, thanks, Jonathan. Yeah, absolutely. One that we're hearing about a lot, actually. Don't be shy, everybody. A, thank you, Charlotte. Yeah, cost of living is definitely an issue for us all. D, yeah, yeah, absolutely. Yeah, yeah. Good, good. Thank you. I mean, there is no coming away from the fact that we are definitely seeing an increase in mental health and well-being challenges across the board. And it's something that is really quite a complex area to get into because of the external things that are impacting people's mental health and well-being. So I'm going to talk a little bit about what are our responsibilities as employers. And although it's not something that we can see, we do nonetheless have a very clear responsibility for mental health and well-being in the workplace. This is covered in a number of places. So first and foremost, interestingly, in the Health and Safety at Work Act, it talks about requiring that people are not put under undue stress. In the contract of employment, there's an implicit expectation at the core that we will maintain employees' health and well-being, which sits around the psychological contract. In the way that we deal with people, it's important that we make sure there are non-discriminatory practices so that people are not put under undue pressure because they feel they are being treated unfairly or differently. And also there's the ethical consideration insofar as what we don't want to do is to put people in a position where they're fearful of coming to work. So all of those factors require you ultimately to make sure that you have mental health and well-being on your agenda. It's really, I think, practically here for us about duty of care. So the legislation aside, what you want to be making sure of is that you are following your duty of care to ensure that your people are feeling that psychological safety, because psychological safety is key in the employment relationship, because if people don't feel that, then they're obviously going to not be able to perform at their best. It will create absences and at worst see people leaving. So things there to think about are what is your duty, or how are you tackling your duty of care for your employees. But the big point here being that we have a responsibility as an employer, even if we don't see that in policies. There is an implicit expectation that we will be looking after employees' mental health and well-being. And actually, what's quite interesting is that I think employees themselves, from what we're seeing, are more and more aware of that right, and more expectant of their employers having this on their radar and making sure that the environment they're working in is free from things like discriminatory practices, and is also helping them feel psychologically safe. The psychologically safe piece, not to be underestimated, one that really was quite impacted through COVID, where, as we know, from a health and safety perspective, people were obviously confined, frightened, and so it's taking a while, I think, to rebuild some of that trust. So be thinking here about how are you executing your duty of care with your people. We have, incidentally, a managing mental health and wellbeing guide that we can provide to you. So there is lots of literature around that will help. As managers, what we often say is that you want to really spot the early warning signs to demonstrate that indicate, that employees will not be in the best place. And we see these as covering three areas. So there'll be physical, psychological, and behavioral signs that you will want to be looking out for, that will indicate potentially that the employee, if they're not maybe so forthcoming, that there is a bit of an issue. Sadly, as we know, there is still some stigma around people feeling that they can't be open about their mental health and well-being. And so when you're thinking about your duty of care, you also want to think about, how is this being positioned in your organization? So how are you making it easy for employees to share this with you if they are, if they are in a tricky place that maybe is leaving them not to be performing at their best? So some of the warning signs to look out for: fatigue, when we're thinking about physical warning signs, often headaches. Sometimes it will be that people will demonstrate tension, so they could be sweating, their appearance appears pale. What I would say up front here, again, practically, is that what we don't want to become is armchair doctors. So do not think that because you are observing one of these things in employees, that suddenly that is a signal or a confirmation that the employee has a mental health and well-being issue. What we are finding a lot is that because of the heightened awareness, thankfully, of these issues, what's also happening is people are doing a lot of self-diagnosis, and we see line managers doing a lot of diagnosis, and we must, unless we are qualified medically, understand that that's not appropriate. So don't, one of the worst things equally to do is to go to an employee and say, you seem to be pale, you seem to be sweating, do you have a mental health problem? Because that really would be a landmine that you wouldn't want to step on, and we can help you with those conversations. One of the other three sets of warning signs will be the psychological warning signs. Now, this probably is something to look out for where we're seeing an increase in home working. So where physically you won't be in the office and therefore may not see the physical symptoms, you certainly may see some of this if you are managing remote workers. So there may be mentions of stress or anxiety. You may find people are tearful. You may generally just find that people are not themselves. They might appear distracted or confused. In this instance, what you want to be doing is just making a note of that. And when you're checking in with your people, just asking them how they're doing. And sometimes even that question in itself is the opener, if you like, to a broader discussion if people are not in a particularly good place. The other piece that is often quite telling is around behavior, and you'll all, I'm sure, have experienced individuals that will not be having a good time, if you like, and will therefore maybe be heightened in their behavior. That could be that some of the tempers are frayed, for example, or some of the speech that they're using is repetitive. This sense may be that they just are laying down and letting things happen around them, so quite resigned to what's happening. Those again will be indications, not least that the employee is maybe not quite happy, that you will want to pick up with them and just have that conversation. So look out for the warning signs. They will often be subtle. And when we talk to clients, we do ask, what is it you think that's happening? And people will always say to us, oh, I've noticed that they've started to withdraw a bit, or they're not on camera on Zoom, or their absence has started to increase a bit more. So there will be tellers, if you like, that you should be looking out for that will help you start to spot something might not be right. So all of that said, what do we do with that? And it really is for us about making sure that you are operating in a culture where people know it's okay to come and talk to you as the manager or one of the team about things that may be bothering them. Again, I guess a healthy dose of reality here is we could have a debate, I'm sure, about the difference between work-life balance, and actually the boundaries are now completely blurred. So what happens in life affects work, and what's happening in work affects life. And what it does mean is that things will spill into work. So although an individual may be dealing with something that's personal and difficult, invariably there may be an impact at work, and we have to face into that. So the way to do that is, first of all, to recognize the signs, and then to create an environment that really promotes people's feeling of security, feeling of confidentiality, so that they can open up to you and tell you what they might be dealing with. Again, I would stress here that what you don't want to do is start to become armchair medics or psychologists or counselors. What you do want to do is to listen and understand what the employee needs. And sometimes even just, as you'll know probably from your own experience, just getting something off your chest may just in itself make the employee feel better. So listening and talking about the type of support that you can provide is going to be key. And thinking practically about that, what we have is a 5-step plan that we can work you through if you are in one of these situations. Most importantly, what you want to be aware of first and foremost is what's your own response. Remember, in these sorts of situations, people will be quite heightened. And so you have to be very mindful of how you respond to an individual when they share that they have a mental health and well-being challenge that they're dealing with. It might be that the situation itself is affecting their performance. And so if that is the case, what you'll want to do is talk to them about how you might help them or adapt. You might want to think about maybe changing a deadline or providing additional support to help them deal with the issue and not feel too demotivated if it's affecting their performance. Support is key. So we want to make sure we're checking in with that individual on a fairly regular basis, and finally monitoring to keep an eye on that person and make sure that they are, where you want them to be. What I would say at this juncture that we are finding clients are finding difficult to deal with is that where there are performance related issues, we're seeing an increase in employees saying, well, the reason that I'm not performing is because I am dealing with a mental health and well-being challenge. And that does make often situations a little bit more tricky. In those kinds of situations, what we always advise is that you separate the two situations. So the performance should be dealt with, but it should be dealt with compassionately whilst trying to help with the mental health and well-being challenges that the employee has. And sometimes that might just mean taking into consideration that that employee is maybe not feeling great, or maybe finding things a bit more difficult, but don't ignore either would be our advice. Don't let mental health and well-being issues stop you dealing with performance challenges. And as I said, we're seeing a real increase in those situations. And talk to me if that's something that you are equally struggling with in your role or team. Now, again, what we are definitely seeing at the moment is a big increase in employees taking legal action and claims. And we are talking about this a lot, where maybe we were seeing one claim every 6 months. We're probably seeing about, 2 claims a month. So you do need to be aware as employers and managers that there are quite serious potential consequences if you don't deal with mental health and well-being at work. That can start with, if you like, employees raising a grievance. So there again, I would share with you that we are seeing an increase and dealing ourselves with an increase in grievances relating to employees feeling they're being put under undue pressure, or line managers not communicating with them. If those situations continue, employees have the right to resign and claim unfair dismissal or constructive dismissal. The difference between the two is that in unfair dismissal situations, employees feel that they've not been treated fairly or the proper processes haven't been followed. In constructive dismissal cases, that will be where an employee feels it's become untenable for them to continue. And finally, resign and claim disability discrimination. So it might be, for example, that an employee is dealing with a very complex mental health condition, and the definition of disability being that if an individual is dealing with something that lasts over 12 months, then that may be considered a disability. So not dealing with these things at work could give rise to that. And again, I can tell you that we are dealing with a case just like that at the moment, which is very difficult to navigate. The big message here from us is deal with things early. Make sure you're spotting the signs, because whilst you've got control as the employer, you're able to do the right things. It's when people leave, things really do go south. Also think about, in terms of the dismissal piece, that an unfair dismissal claim can cost you up to £20,000. A disability discrimination case can be uncapped. So there's a very real financial and reputational risk in not dealing with these things properly. So then, I guess, just to kind of draw this to a close, how then should you be approaching this? What we would say always is that the symptom and cure piece is, the cure is to make sure the culture is such that people know that they can share with you when things are not right. It's important that you have the right tools in place, because this is a very complex and difficult area to navigate. That you've got policies, for example, in terms of absence and mental health and well-being support in place, so employees can see that. And finally, making sure managers are trained to deal with difficult situations. Internally, what we would recommend is that you have an employee assistance program, that you've got an occupational health support service on hand. You might want to think, and these are really good, you might want to think about having mental health first aiders, and again, training. And it's really, I think, for me, I mean, there's a lot there, right? But really, if you took one thing away from this and had no money and not much time, the big thing to focus on that makes the real difference is letting people know that you care and that they can come and talk to you, and that it's okay to not feel great, and it's okay to be able to talk about those things. So this isn't really about having to spend thousands. It's really almost a bit about a culture check, if you like, around where you are and where your management teams are. We do have information on absence management. I've done a screen grab there, so we can help you with that. We can help in all of those areas. And just in the interest of time, what I'm going to do now is stop as promised and move into our Q&A session, which is our last 10 minutes. So feel free to come off mute, raise your hand, and ask any questions that you have.
Hi, David. Uh,
Hi.
Just a question on one of the points that you made around how you balance mental health issues and performance issues. I know you said that separating the two is kind of the way forward, but practically, do you have any words of wisdom? I know it's a difficult topic and it's on a case by case basis, but when you're kind of in the midst of it, what are your initial thoughts and words?
Yeah, it's a brilliant question, Romina. Thank you. So taking maybe a simple case, so let's say, for example, a probationer is not doing well in their probation period, gets to the 3-month point and says, look, the reason I'm not doing well is because I am suffering with depression, just hypothetically. So in that sort of instance, what you tend to want to do is to understand what is the impact of the impression on your ability to do that job. Yeah, because this is all about how then do we make the right adjustments so that you can then achieve what we need you to achieve. And that's the angle to focus on. So examples of that might be the employee might say, well, look, I am struggling with deadlines, or I find it difficult that my manager is critical and I'm internalizing that, and that's a challenge for me. And so the response would be, okay, great, we'll talk to your manager. But what it doesn't do is it doesn't distract from the need for that employee to perform what's required in that role. So the idea is that you're making adjustments, reasonable adjustments, to allow for what that employee is dealing with, whilst continuing to set an expectation that there is a level of performance, a minimum standard of performance that's expected. Now, hopefully, those adjustments mean that that employee then achieves what's needed because you've helped them get to that point, right? But it might be that that doesn't happen. And that's where it becomes quite difficult, because you then have to decide whether the adjustments have been reasonable enough that under the circumstances they should be able to perform. And then it maybe is a matter of whether that employment relationship should continue or not. And then it might be then that you have to go out and look at an occupational health intervention, or further conversations with the employee. So the headline here is make the adjustments reasonably, agree them with the employee so that you have that employee's consent to understand that if you do this, I'll be able to get to here. But it's not, and often it's a good question, because we see managers go round and round and round and round this circle. But unfortunately, there can be a place where dismissal is appropriate if, in your view, what should be achieved based on what you've been told hasn't been.
Thank you.
Pleasure.
David, we have a couple of comments in the comment chat box.
Thank you. How would you manage absence when it comes to mental health? Charlotte, great question. Carefully is the answer. What you really want to understand first and foremost, if it's short-term absence, is what's the reasons? Is there a pattern? And really hold the employee to account. If it's long-term absence, it's a whole different manner of management, where you will want to maybe involve occupational health, work with the employee to understand what, if there is a more serious condition, and what the return to work looks like. There isn't, I think, in my experience, Charlotte, a one-size-fits-all approach. But what you do want to make sure is that you follow good process and you treat people consistently. And then, as I say, if needs be, use interventions like us or occupational health if things are getting tricky. Nalaxi, one of many, Nalaxi. How can we mitigate risk factors in the workplace that affect employee mental health well-being? Really great question. Thank you. The way to mitigate it is to think about what is the culture that we've got in place? Are we making space for people, or are our managers making space for people in their one-to-ones to check in, for example? Do we have an employee assistance program that people can talk to who are independently able to support and advise away from the workplace? Do our policies support mental health and well-being challenges? Are our expectations in line with what people can deliver? Have we got our finger on the pulse? Can we do employee surveys to see how people are doing? I think with mental health and well-being, it's something that you want to, and your managers should be checking in on little and often, just so that they can keep a careful eye if people seem to dip. Because, you know, in real life, people will ebb and flow, right? So we don't want to raise the alarm bell just because one morning someone comes in and they're not particularly smiley just because, right? And that's the other thing, is not to overemphasize everything is a mental health and well-being problem. Devon.
Yeah, thanks, David. I'll just sort of pick up the last point you're making, really. Isn't it about not focusing on reacting to these issues, but having in place positive, good standards about supporting your people? And this just flows as part of that. So you're already creating a framework where you're engaging with people, not waiting for things to go awry in their lives, really. So it's about maintaining a set of good practices about engagement, which sort of ferments the culture.
It really is, and really articulately put. Thank you. It is about that, absolutely. And it's about managing through process rather than managing by condition. Insofar as we can't get too deep into these things with people, you know, what's really important is to make sure that people are feeling safe and healthy at work and ultimately can perform, because that's why we employ people, right? So you're right to say that it is about following good process, having good culture, and being cognizant of people's individual needs. But often what I find is that people try to manage these mental health and well-being challenges by trying to overly understand the mental health and well-being challenge, you know, so it's this whole point almost to being armchair psychologists or armchair doctors. We don't want to get too far into that just to stress, because that is, you know, that's not going to be productive. But what we want to do is to give people the tools to help them do their work and feel hopefully a bit better with it. Any other questions? No? Devon's waving. I don't know. Are you waving for help, Devon, or are you no? Okay. Fantastic. Well, these were designed to be snappy sessions, so if there's no further questions, I will leave it there. So in terms of next steps, what I would just ask you to do is to think about your risk areas. How are you going to mitigate them? Make sure you've got the right documents and policies and the right HR advice in place. Thank you so much for joining us. As I said, we are running these HR how-to sessions over the next 4 to 6 weeks. The next one is going to be about recruiting the best people, and then we're going to be looking at grievances. Do feel free to feedback to me. Do let me know if there's particular topics you want to do. These are all free, and we're always more than happy to run them. A bit of a shameless plug at the end there for the business. So the HR department is your outsourced HR function. We provide everything that you would expect from an in-house HR department, but it's all outsourced. Give us a call if we can help with anything that I've just talked about. We do very often have just very confidential conversations with people who maybe don't have people to share these issues with as line managers or employers. That's a space that we're happy to support in. and stay connected. We will follow up this with, with the presentation and some other guidance notes. But it just leaves me to say thank you so much. It's been a real pleasure, and hopefully see you again.
Thank you.